So there's a couple of doctors from Australia, Western Australia, that got a Nobel Prize for discovering that Helicobacter pylori causes stomach ulcers. They were even putting Helicobacter pylori into someone's stomach and, yeah, stomach ulcer. But you know what my question is? Well, were they dehydrated? How much water were they drinking? Are they coffee drinkers?
Imagine your stomach as a fortress. You've fortified the walls with meds and mighty meals, only for a tiny bacterial spy to slip through the cracks and blow it all up again. That's the ulcer comeback story, and today we're exposing the culprits behind it. This video is for educational purposes only and isn't meant to replace medical advice. Always talk to your doctor before making any health changes. Why do ulcers keep coming back? Unraveling the mystery of recurring peptic ulcers. Hello, welcome back to the channel, your go-to place for natural remedies and wellness tips to help you thrive. Today, we're embarking on a deep dive into a persistent and frustrating health challenge. Why do peptic ulcers keep returning even after treatment? If you've felt that gnawing, burning pain in your stomach creeping back despite medications, dietary changes, or even natural remedies, you're not alone. Peptic ulcers, open sores in the stomach lining or upper small intestine, can feel like unwelcome guests who keep knocking at your door, no matter how many times you send them away. Research from the American College of Gastroenterology indicates that 10 to 30% of peptic ulcers recur within a year, and up to 50% within 5 years, even with treatment. These numbers can feel daunting, but understanding why ulcers come back is the first step to breaking this cycle. Today, we'll unravel the mystery behind recurring peptic ulcers, exploring the culprits from bacterial infections to lifestyle traps, and arming you with practical, evidence-based strategies, including natural remedies, to keep them at bay. Let's dive in and take control of your gut health for good. 1. Incomplete eradication of Helicobacter pylori, H. pylori infection. The leading cause of most peptic ulcers is Helicobacter pylori, H. pylori, a spiral-shaped bacterium that's both cunning and resilient. This microbe burrows into the stomach's protective mucus layer, disrupting its defenses and allowing stomach acid to erode the delicate lining underneath. Standard treatment involves a combination of antibiotics, like amoxicillin and clarithromycin, and proton pump inhibitors, PPIs, to reduce acid and kill the bacteria. However, eradicating H. pylori isn't always a slam dunk. Globally, antibiotic resistance is a growing issue affecting up to 20% of cases, particularly with drugs like clarithromycin, according to the World Health Organization. Resistance allows small pockets of bacteria to survive treatment, setting the stage for ulcers to return. In regions with high resistance rates, such as parts of Asia and Southern Europe, recurrence can be even more common. N. pylori is a master of survival. It produces enzymes like urease, which neutralizes stomach acid, creating a cozy microenvironment where it can thrive. Even when symptoms subside after treatment, surviving bacteria can hide in gastric glands, evading antibiotics and PPIs. Over time, these dormant colonies can repopulate, reigniting inflammation and ulcer formation, especially when triggered by factors like stress or poor diet. The National Institutes of Health highlights that successful H. pylori eradication reduces ulcer recurrence to under 10%, compared to a staggering 50% when the infection persists. Yet many patients skip post-treatment testing, like urea breath tests or stool antigen tests, assuming symptom relief means the bacteria are gone. This oversight is a major driver of recurrence, as lingering infections go undetected. Comment H. pylori below and share how long you've been using natural remedies like mastic gum or broccoli sprouts to support H. pylori treatment, or any tips for keeping them hygienic, like proper storage or disposal. Your insights could help others stay safe with natural ulcer remedies. 2. Continued or resumed use of NSAIDs and other irritating medications. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, or naproxen, are a double-edged sword. They're lifesavers for pain and inflammation, but they're notorious for wreaking havoc on your stomach lining. NSAIDs work by inhibiting cyclooxygenase, COX, enzymes, which reduce inflammation but also block prostaglandins, compounds that protect the stomach's mucus layer and promote blood flow for healing. Without this shield, stomach acid can erode the lining, causing or reopening ulcers. The Journal of Gastroenterology reports that NSAID users face a 40–50% higher risk of ulcer recurrence, particularly with high doses or long-term use. Even after an ulcer heals, resuming NSAIDs without protective measures, like taking them with PPIs or a full meal, can trigger a relapse in weeks. NSAIDs disrupt the delicate balance between acid attack and mucosal defense, much like removing armor before a battle. Chronic NSAID users, such as those managing arthritis or chronic pain, are especially vulnerable, as they often return to these drugs post-treatment without realizing the risks. Even occasional use, like popping ibuprofen for a headache, can irritate a recently healed stomach lining. Combining NSAIDs with other medications such as corticosteroids, blood thinners, e.g., warfarin, or selective serotonin reuptake inhibitors, SSRIs, amplifies the damage by further thinning the mucus barrier or increasing bleeding risks. According to UpToDate, even with PPI protection, 5% of NSAID users still face ulcer recurrence, underscoring the need for caution. Education is critical. Many patients underestimate the risk of over-the-counter NSAIDs, assuming they're safe because they're widely available. Work with your doctor to create a pain management plan that minimizes ulcer risks, and avoid the temptation to fall back into old habits. By making informed choices, you can protect your stomach and keep ulcers from staging a comeback. Comment NSAIDs below and share how long you've been using natural pain relief remedies like turmeric or ginger to avoid NSAIDs, or any tips for keeping them hygienic, like proper storage or disposal. Your insights could help others manage ulcers safely. 3. Persistent lifestyle factors like smoking, alcohol, and stress. Lifestyle choices play a massive role in whether ulcers heal or return. Smoking is one of the worst offenders. Nicotine not only increases stomach acid production, but also reduces blood flow to the stomach lining, slowing healing and weakening the mucus barrier. It also interferes with H. pylori treatment by reducing antibiotic efficacy. According to Mayo Clinic proceedings, smokers have double the risk of ulcer recurrence compared to non-smokers, and quitting can reduce this risk by up to 30%. Many patients quit smoking during treatment only to resume afterward, unaware that even occasional cigarettes can reignite the ulcer cycle by disrupting healing tissues. Alcohol is another major player. Excessive drinking, especially hard liquor or binge drinking, directly irritates the stomach lining, increases acid production, and delays healing, like pouring salt on an open wound. Studies in Digestive Diseases and Sciences show that heavy alcohol use raises ulcer recurrence rates by 20 to 40%, with the risk highest in those who resume drinking post-treatment. Even moderate alcohol can irritate a sensitive stomach, particularly if consumed without food. While red wine in small amounts may have some gut protective antioxidants, the risks often outweigh the benefits for ulcer patients. Stress, while not a direct cause of ulcers, is a powerful amplifier. Chronic stress triggers cortisol release, which boosts acid production and impairs mucosal repair. The gut-brain axis means emotional stress can manifest as physical symptoms, with many patients reporting ulcer flares during high-pressure periods. Like work deadlines or personal crises, spicy foods, caffeine, and acidic foods, e.g. citrus or tomatoes, don't cause ulcers but can exacerbate symptoms, tempting patients to slip back into poor dietary habits post-treatment. Breaking these lifestyle traps is challenging but transformative. Quitting smoking is non-negotiable. Nicotine patches, counseling, or apps like Quit Now can help. Limit alcohol to small amounts, ideally with meals, and opt for low-acid options like diluted wine if you must drink. Stress management is equally critical. Mindfulness practices such as meditation or deep breathing can lower cortisol levels, while yoga or Tai Chi supports both mental and physical healing. Natural remedies like chamomile tea, which has anti-inflammatory calming properties, or ashwagandha, an adaptogen that reduces stress, can complement lifestyle changes. A 2020 study in Journal of Ethnopharmacology found chamomile reduced gastric inflammation in animal models, suggesting potential benefits for ulcer patients. Comment lifestyle below and share how long you've been using natural stress relief remedies like chamomile tea or meditation to support ulcer recovery, or any tips for keeping them hygienic like proper storage or disposal. Your insights could help others keep ulcers in check. 4. Underlying medical conditions and idiopathic factors. Sometimes ulcers recur due to hidden or complex medical issues that standard treatments don't address. Rare conditions like Zollinger-Ellison syndrome, a disorder where gastrin-secreting tumors cause excessive acid production, can make ulcers resistant to therapy. This condition affects less than 1% of ulcer patients, but leads to relentless recurrence without specialized treatment, such as surgery or lifelong acid suppression. Other chronic conditions like chronic obstructive pulmonary disease, COPD, kidney failure, or autoimmune disorders weaken the body's healing capacity and immune response, increasing recurrence risks. Older adults, particularly those over 60, face a 30% recurrence rate compared to 15% in younger patients, per clinical gastroenterology and hepatology, due to age thinning of the stomach lining and polypharmacy. Idiopathic ulcers, those without clear H. pylori or NSAID links, are a particularly frustrating mystery. These account for 10 to 20% of cases in developed countries and have recurrence rates as high as 50 to 90% over several years, according to Gut and Liver. Potential causes include genetic predispositions, microvascular issues that impair healing, or rare infections like cytomegalovirus (CMV) in immunocompromised patients. These ulcers often require advanced diagnostics such as repeat endoscopies, biopsies, or gastrin level tests to uncover hidden triggers. Unfortunately, limited access to such tests or reluctance to pursue invasive procedures leaves many cases undiagnosed, perpetuating the relapse cycle. Routine screenings and open communication with your healthcare provider are crucial. If you have a chronic illness or suspect an underlying condition, advocate for thorough testing to catch hidden culprits early. This proactive approach can prevent complications like bleeding, perforation, or gastric obstruction, which occur in 10 to 20% of recurrent ulcer cases. Comment underlying conditions below and share how long you've been using natural remedies like licorice root to support ulcer healing with chronic conditions. 5. Non-adherence to treatment and inadequate follow-up. Even the best treatment plan is useless if you don't follow through. Non-adherence, skipping doses of antibiotics or PPIs due to side effects, cost, forgetfulness, or feeling better prematurely, is a major reason ulcers return. Studies in alimentary pharmacology and therapeutics show that adherence to ulcer treatment regimens is only 60 to 70%, leaving room for H. pylori to persist or acid levels to rebound. Incomplete 10 to 14-day antibiotic courses are particularly problematic, as they allow bacteria to develop resistance, making future treatments harder. For example, clarithromycin resistance rates have climbed to 30% in some regions due to improper use, per clinical microbiology reviews. Follow-up testing is another weak link. Many patients assume symptom relief means the infection is gone and skip recommended tests like the urea breath test or stool antigen test 4 to 6 weeks post-treatment. The American College of Gastroenterology emphasizes that these tests are critical to confirm H. pylori eradication, yet 20 to 40% of treatment failures go undetected due to poor follow-up. This is especially common in areas with limited healthcare access, where patients may not have the resources or awareness to pursue testing, leading to higher recurrence rates. Follow-up testing is non-negotiable. Schedule it in advance to stay on track, and don't rely on symptom relief alone. By committing to the full treatment and verification process, you can break the relapse cycle and ensure lasting healing. Comment adherence below and share how long you've been using natural remedies like aloe vera to complement ulcer treatment, or any tips for keeping them hygienic, taking charge of your gut health. By addressing these root causes, you can slash recurrence rates and reclaim your gut health. The journey may feel challenging, but every step, whether it's a natural remedy like mastic gum or a lifestyle shift like meditation, brings you closer to lasting relief. If this deep dive helped you understand why ulcers keep coming back, give this video a like, subscribe for more gut health tips, and share your own strategies in the comments below. Let's keep those ulcers gone for good. Here's to a healthier, happier you.